Okay, I think we are ready to start. Right. Good evening, ladies and gentlemen. My name is Severe Venkataraman. I'm your host for this evening's webinar. The topic for this evening is artificial intelligence in embryo selection. So just bear with me while I get the slides up. Okay. So first off, I'd like to introduce this evening's panel. So we have Sam Knight, who's our embryology lab manager at Harley Street Fertility Clinic, and Christina Hickman, who's the Vice President of Clinical Affairs at Fertility. And the agenda for this week, I'm going to give you a bit of an overview on what we're focusing on so that you can understand where it might fit in your journey. And then Sam's going to talk us through the historic process of what we currently, what we have been doing in terms of choosing embryos. And then Christina's going to talk about what we're going to do and why it's better and how it helps. So without further ado, in terms of an overview, we're talking about IVF treatment and how we choose embryos in an IVF treatment. So typically, if you think about it, in an IVF treatment, what we do is we stimulate a woman's ovaries to try and produce as many follicles that contain eggs in the ovaries as possible, safely. And then we collect the eggs that are in those follicles when it's the right time to do so. And then we fertilize them using a sperm sample on that day. So we fertilize all the eggs, and then we let them divide into embryos, and we grow them in the embryology lab for about 5 days. And then once that's done, there's a couple of options. Now, your treatment can essentially fork at this time point. We can put the embryo back fresh and hope to achieve a pregnancy. So we do a pregnancy test and a pregnancy scan to confirm it. Or what we do more commonly these days is that we will freeze the embryos, and before we do that, we'll take a small sample, we'll biopsy the embryo and send those biopsies off for genetic testing to see whether the embryos have the right number of chromosomes, essentially whether they're sort of significantly normal or not. Once the results of that are back, we then prepare you for the embryo transfer. In due course, we thaw out the frozen embryo that we're going to use, and we transfer it, and then we confirm the pregnancy with a pregnancy test and a pregnancy scan. But how do we pick which embryo to transfer? So at this point, I'm going to hand you over to Sam, who's going to talk you through embryo culture and assessment. Thanks, Sam.
Good evening. So historically, we used to take embryos out of an incubator and look at them at set times. So on the day of egg collection, we would expect it to be a single cell as an egg. And on day 1, following the egg collection, we would expect to see 2 pronuclei, so signs of fertilization, 1 from the egg and 1 from the sperm. And then on day 2, we would expect it to be 2 to 5 cells. And on day 3, we would expect it to be 6 to 10 cells. And on day 4, a morula, so that we can still see cells, but there are too many to count. And then on day 5 and 6, it's from a blastocyst. So next slide, please, Smith. So historically, we would only look at those once a day, taking them out of the incubator and having a snapshot of what they look like. So embryo grading, the majority of cycles at Harley Street Fertility go to blastocyst stage. So we grade our embryos, the part, the inner cell mass that goes and becomes the baby, and the part, the trifecta, which is the placenta. Okay, and we give them a numerical grade for the expansion, so how far along in the blastocyst development the blastocyst is. So 1 would be an early blastocyst, 3 would be a full blastocyst, 4 would be an expanded blastocyst, 5 would be a hatching blastocyst, and 6 would be a fully hatched blastocyst. And then we give them 2 letters, 1 for the inner cell mass and 1 for the trifectoderm. And A's are the top grade and D's are the lowest grade. Next slide, please. So historically, we've looked at if an embryo has the right number of cells for the timing and the stage of the embryo. We look at the symmetry of the cells, so are they an even size or are they an uneven size, depending on what cell stage they are. We look for degrees of fragmentation. We look at the appearance of the cells, and we check that they are, the development pattern is as we would be expected. So 2, 4, 8. So things then progress. So we have time lapse, and all our treatment cycles go through time lapse culture. So we have an embryoscope, and what that allows us to do is not disturb the embryos, but it also allows us to play back the videos and watching the embryo develop and see if there's any abnormal occurrences that happen with the embryo. So I think Sophia has probably got a video to watch. So historically, we've just looked at how the embryo looks down the microscope or in the embryoscope, and if it's developing at the right speed, the days that it's the stage at. Can you go to the next slide, please? So traditionally, incubators, embryos were placed in an incubator. They were taken out once a day, and a snapshot was taken of the observation that was seen at that time. They were disturbed by taking out the incubator and moving to a microscope. With time lapse, obviously they're in the incubator, it has a microscope and a camera inside. They're photographed every 15 minutes, which allows us to have a time lapse video and remain undisturbed. We get a continuous monitoring of the embryo's development, and it allows us to look at the embryo's morphokinetics and other events. For example, you see some embryos reverse in cell numbers and then continue to grow. Thank you, Steve. So I think at this point, I'm probably going to hand over to Christina, who's going to tell us how things are going to develop at HSFC.
Thank you very much, Sam. So my name is Christina Hickman. I'm the VP of Clinical Affairs. I've been an embryologist for almost 20 years. And today I'm going to talk to you about the latest technologies in embryo selection using artificial intelligence, which is being used at Harley Street Fertility Clinic. Next slide. Invariably, what happens is that we are faced with a situation where we have a lot of embryos in front of us. And when a patient has a lot of embryos, we have to choose which one is suitable for us to treat, which is the best one to be transferred back, and which are the embryos that we're going to freeze, and which are the embryos that are not really suitable for treatment. So you have these in green are the ones that, for this particular example, patients were selected for transfer. In blue are the ones that we chose to freeze, and in red are the ones that we chose to discard. But if we choose the right embryo, it's great, because it means that we have maximized the chance for this particular patient to have a baby. But if we choose the wrong one, and if instead the patient has to go through multiple cycles of cryopreservation and frozen embryo transfers to finally reach that baby, this is not really fair on the patient. And it's also not really, it's a waste of money, it's a waste of time, it's a waste of the emotions as well of the patient. We want to make the best journey for the patient possible. And to do that, we need to find a way to get that choice right every time. Next slide, please. So to choose an embryo, as Sam described, traditionally, we would simply look at the embryo. We take the embryos out of the incubator and we look at the embryo under a microscope. And we choose the embryo based on which one is the prettiest embryo. And those that we think are not pretty enough are the ones that we choose to discard. The problem is that when we take the embryo out of the incubator in order to look at them, the embryos are not in their best possible environment. So we have to do this really, really quickly in order to bring them back to the incubator to keep them safe. And in doing this quickly, sometimes we are not able to capture all of the information at once. Next slide, please. So this is why at Harley Street, we use the time-lapse incubator. So in the time-lapse incubator, you're able to see the video of the embryo developing. Does the video play? So what the incubator does, it takes lots of pictures of the embryo during embryo development so that we can see this progression. Next slide, please. Another way for us to choose which embryo to transfer back is to do a microsurgery on the embryo. If you can see here, the cells on the left, it's like a little ball of cells. Those cells are the ones who are going to hopefully become a baby. But this ball of cells that surrounds it, the cells that will hopefully become the placenta, there's lots and lots of cells, and the embryo doesn't need all of them. So instead, what we do is we take a few of these cells, and we use these to make a genetic assessment of this embryo. So what we can sometimes do is use a genetic analysis together with the time-lapse information to use the maximum amount of information available on the embryo to choose which one we're going to transfer back. Next slide, please. The challenge we have is that when we combine all of this information together, especially when we're using time-lapse, we actually have a lot of information at our disposal. In fact, we have 2.5 billion data points on every embryo that we have available to transfer. So this creates a bit of a problem because it's so much information. How do we process all of that information at once? How do we make sure that we don't miss any important pieces of information? Next slide. Another challenge we have is that embryos can sometimes surprise us. So what we have here are pictures of embryos that many clinics consider for discarding. They might make the assessment that these embryos are not suitable for treatment, but all of these embryos that you have here are embryos that have led to a live birth baby, a healthy live birth baby. So embryos can surprise us as well. Next slide. We did a research that we published in the Nature magazine together with 5 embryologists from 5 different countries. And what we found is that when we bring embryologists from across the world, they don't always agree on which embryo to transfer back. So here we have the assessments. On the right, you see a Venn diagram that shows the assessments by 5 different embryologists. And in fact, out of the 395 embryos we looked at, we all only agreed on 89. Now, this is an extreme case where the 5 embryologists are from 5 different countries, trained in slightly different ways. But still, this highlights the fact that we do need an international language of how to assess whether an embryo is suitable for treatment or not. Next slide, please. So we decided to look at the embryo in a slightly different way. Next slide. And this is Chloe. So introducing Chloe, which comes from culturing human life through optimal embryos. So what we do, Chloe is the first and only transparent AI assistant. And Chloe's job is to help the embryologist assess all of those 2.5 billion data points together and determine and predict what is the chance of this particular embryo leading to a healthy live birth. So the name Chloe is interesting because it has a Greek origin, which means green sprouts, and represents blooming and fertility. Next slide. So life, even in its earlier stages, is rich with a lot of stories. We have a lot of information that comes from the embryos, and I'm going to show you a few examples of some of these stories. Chloe can help us unlock a whole new frontier of information that comes from the data to help us discover the untold stories across the entire embryo development. Next slide. So here's a video of an embryo developing very early on. And those two yellow dots that you see on the left are what we call the pronucleates. Chloe highlights them to the embryologist and allows you to see the two pronucleates. Now, interestingly, one of these comes from the mom, the other one comes from the dad. Next slide. And what then happens is that they merge together. And this is when the genetics of the embryo becomes its own. The embryo then starts to divide into individual cells and starts growing in the number of cells. Now, Chloe automatically is capturing all of this information and is counting the number of cells for the embryologist automatically, is determining when the embryo reaches the morula stage, is determining when the embryo reaches the blastocyst stage. So the blastocyst stage is a stage that the embryo reaches on the 5th day. The Chloe also helps to highlight the important parts of the embryo. So here in green, you have what we call the inner cell mass. This is the part that will hopefully become the baby. And in purple, you have what we call the trophectoderm, which will hopefully become the placenta. And these parts that are highlighted, it not only highlights them, but it captures some minute pieces of information that are in these two important parts of the embryo. And some of these pieces of information we cannot see with the naked eye. It does all of this automatically, not only saving the embryologist time, but almost giving the embryologist superpowers to see things that couldn't be seen before. Next slide. The Chloe can also help identify things that are not going quite well for the embryo. So here we have two examples. On the left is so as you saw before, the embryo is supposed to have two genetic packages, but sometimes it only has one, as you see on the left. And other times it's got 3 packages. Now, this isn't normal, and it can be missed sometimes by the embryologist, but Chloe is there to help support the embryologist by saying, look, we're highlighting here for you. This one has 1 and this one has 3. Now, Chloe cannot work on its own. In fact, the best way is to get Chloe together with the embryologist. So the embryologist is there supervising the artificial intelligence. Next slide. Some other interesting anomalies that the embryos can do is that when we're counting these genetic packages, you're supposed to only have 2, but sometimes you have what we call a micro-PN. That's the one on the left. And sometimes you have something called a vacuole, which looks like a PN, but it's not quite a PN. So you can see that one on the right, in the bottom right corner at the 5 o'clock point. Okay, so yeah, there you go. So that's being highlighted. So that is not a pronucleate. And Chloe can help the embryologist highlighting, look, this one is not a PN, the other ones are. So this very important stage of the embryo development happens on the 1st day, and Chloe is there every step of the way, helping the embryologist identify the features that they need to identify. Next step. Here's another example where Chloe can pick out automatically something called fragmentation. So fragmentation is when the cells of the embryo identify little packages that are not behaving properly. And it's really interesting that the embryos are able to compartmentalize these bits that are not behaving properly and exclude them from the embryo. This is actually normal embryo development when that happens. However, when it happens too much, it's a bit of a problem. And Chloe can identify and quantify when it is that this is happening too much, helping the embryologist understand that this might not be a normal embryo for transfer. Next slide, please. Another example of an anomaly is what we call a direct uneven cleavage. So ideally, you want the embryos to go from 1 cell to 2 cells, but ever so often, it might go from 1 cell directly to 3 cells. And this is not a good sign. So Chloe highlights this to the embryologist so that this isn't missed. Next slide. It's not always bad news. Sometimes Chloe sees no problems at all. It looks at the embryo, assesses it all the way through, and thinks, you know what, this embryo looks really good, and is behaving the way you would expect. And this can be really reassuring to the embryologist. The embryologist looks through the video and didn't see anything. And then Chloe confirms that to embryologist, saying, I didn't find anything either. So this is reassuring to the embryologist, not only highlighting the problems, but also highlighting when things are developing normally. Next slide, please. So in a way, Chloe simplifies all that information in a way that makes the embryologist have the information that they need to have at the right point of the decision-making process, and hopefully not miss anything important. Next slide, please. So what Chloe does is that Chloe brings standardization across all fertility professionals, so that you always know that you're having the best possible care delivered to you. Chloe also allows this information to be shared with you. So allowing you to have full visibility into your treatment. You're able to receive images of your own embryos. And the embryologist from Harley Street Fertility Clinic will explain to you what you're seeing so that you can understand your own embryos. You can understand your own treatment, your own IVF journey. And this will hopefully empower you to have meaningful discussions, not only with your embryologist, but also with the doctors at Harley Street Fertility Clinic, so that you can make the best decisions for you together. Next slide. So in conclusion, IVF truly will never look the same again. And really like to congratulate Harley Street Fertility Clinic to being such an innovative clinic to bring the best technology to their patients, the best technology to you. Thank you very much.
All right. Thank you very much, Christina and Sam. I'm going to open it up for questions. You can submit any questions you have via the Q&A function on Zoom, or you can raise your hand if you have any questions. But I have a question actually first, if you don't mind, for Christina. Christina, where do you see this bringing the most benefit to the embryology lab?
So there's many benefits for the embryology lab. So one of the things is that it actually saves a lot of the embryology time, meaning that the embryologist can spend loads of time with the patient instead. So one of the things that Harley Street Fertility Clinic is really good at is giving that customized care to the patient, giving all the time that they need to answer all the questions they have. So by providing all this information transparently to the patient not only has the transparency, but now they can participate in their treatment. And you have a very experienced team that can now help the patient fully comprehend their own care. So I think that transparency is a big benefit from the embryology to the patient. The second one that I wanted to highlight is a reduction in risk, the risk of missing important information. And sometimes this is information that could make a big difference to the patient, which will lead to hopefully the best embryo being picked every single time. Okay, so this is what we want, is to maximize the chance of the patient throughout their care. And this point of the treatment of choosing the embryo is a very critical stage of the process.
So it means that they're spending less time sort of doing the nuts and bolts, but actually more time critically thinking about which is the best embryo for transfer and having that discussion with the clinician or the patient. If I understand.
Exactly.
Yeah.
Yes.
Thank you very much. I don't think we've not had any other questions come through. I do have one more question, if that's all right, which is, how do you think this might impact success rates?
So we're doing some preliminary research projects at the moment, and we are running some RCTs. it follows logic that if you're always picking the best embryo consistently, that this will improve success rate. We're still running the studies to be able to make that statement. But one thing we know for sure from the studies we've done is that standardization does happen. And we have already proved that with studies from clinics from around the world. So irrespective of of the level of skill, I mean, Harley Street is very lucky that they have highly skilled embryologists. But what we've seen from around the world is that irrespective of the level of skill of the embryologists, we can bring in the standardized best embryo selection at every point if they're using Chloe. So this is something that will bring this consistency also in Harley Street, but in a way that gives that extra reassurance to the patients as well. So the patient knows that you have a second opinion in every embryo selection, which is there as to reduce that risk in that decision-making process.
Thank you. And then on a more sort of practical note, Sam, what do you think is going to be the biggest benefit of this?
I think it is reassuring that you have a second opinion, because sometimes you would have more than one embryologist look at embryos and you would have that discussion between two people. But as Christina knows, looking at embryos can be very subjective when it comes to people making decisions, because some people grade really harshly and other people are more generous with their grading system. So hopefully it will give better outcomes for our patients, but it will also give us more time to spend discussing the cycle with the patients as well.
And that's a really interesting point you bring up about sort of differing opinion about grading embryos. Now you're going to have a third. Let's say you have two people look at it, and now you have a third, which is Chloe. What do you do when you all disagree or you all have slightly differing opinions? How do you try and sort of standardize that or reach a consensus?
We try and reach a consensus without Chloe, but with Chloe, it's quite interesting because we have seen that sometimes Chloe ranks the same as the embryologist, which is quite reassuring. When it doesn't, there's a big debate. But I think there are some other features which I'm sure Christina can sort of go into more depth about the way that it can grade or give a percentage chance of that embryo implanting. Is that right, Christina?
That's correct. So we use what's interesting is that at the fingertips of the embryologist, we now have the assessment of hundreds of thousands of patients that have led to teaching Chloe. And this is right there in front of the embryologist as a support system to make a decision. So there's a comparison of this embryo with all this huge database of knowledge. So it really is a data-driven decision process as opposed to an opinion. Now, when we're looking at embryos as embryologists, we have the clear ones that all of us will agree on. But the problem is that embryos are dynamic. And as I said before, there's so much information for us to take into consideration. We might maybe agree on what the embryo looks in the last image, but we don't have the time to sit down and discuss every single image that was captured with a time lapse. So what Chloe sometimes does is that you might get two embryologists that I would have ranked this embryo last, and then Chloe comes in and I want to rank it first. And in this particular case, it makes the embryologist, I want to look through this embryo again. Let's figure out if Chloe saw something that we didn't, and so it's almost highlighting. So there's some cases the embryologist will agree with Chloe and reassuring, okay, let's transfer. And in other cases, it allows that second opinion to go, I want to have a second look in this particular embryo. We don't have the time to look at every single embryo 2 times, but we do have the time to look at the ones that we disagree on. And I think this is a time better well spent. So the embryologist can always make the most critical assessment of every single embryo.
Thank you both. And we have a question from an audience member, which is, well, first of all, to say thank you. Lovely videos of the embryos. It's amazing to see all those little cell divisions. Question for Christina. What is, I'm going to paraphrase the question slightly. It says, is there always conformity in grading with Chloe and experienced embryologists? I'm going to ask you, what's the degree of conformity?
So at Harley Street Fertility Clinic, what happens is that all the embryologists go through a control process. We call it quality assurance and quality control. So this is done on a regular basis, and it's a way to test all the embryologists and try to bring as much consistency as we possibly can between different humans. Okay, so this is the right standard of care, and this is how we try to achieve the best possible consistency and standardization. But it's still not as high as using a machine to do the assessment. The machine will always look at the embryos in the same way. So whilst an embryologist might feel a bit more critical one day than on another, just because it's human nature, right? We are humans. And this is something that the machine can do extremely well. So that's really the main benefits that kind of comes from that assessment.
So really, it's sort of it's trying to make you as consistent and sort of fair as possible from day to day.
Exactly.
And then the second part of the question is, Sam, how do you feel about using Chloe?
We're really excited about using Chloe as an embryology team. We've done some validation. We think there's a lot more that could be used from Chloe in the future. So at the moment, as Sophia said in the beginning of the presentation, most of our cycles at HSFC are blastocysts biopsied, tested, and the embryos are frozen. And people come back subsequently to have those transferred. We're looking at some interesting results from that. But at the moment, I think it's going to be really quite interesting to compare, as time goes on, the ones that come back as being chromosomally normal and the ranking system on Chloe. So we'll see how it goes from there, but we're really excited about using it.
Very nice. Thank you very much. I think that's a good note to sort of wrap this up on. I think I can sort of summarize, I think data is always helpful, but the problem that the embryologist now faces is we generate too much data, and it's, we need a way of digesting that and focusing our efforts on what really matters. And so I think using machine learning and artificial intelligence to sort of narrow our focus a little bit will help us digest the mountain of data and hopefully improve clinical outcomes. As always, we're always happy to help if someone's had a very difficult journey and they want a second opinion. But as Sam said, we are quite excited about the potential benefits of Chloe and the technology that comes with it. So I'd like to just draw your attention then to the next webinar that we're going to have in October. It's called To Freeze or Not to Freeze, and it talks about fresh or frozen embryo transfer. And I'm sure it'll be quite a contentious debate. So without further delay, I'd like to thank our panel. Thank you very much, Sam. Thank you, Christina. And thank you, Noam, for being the man behind the scenes to get all this together. And I'd like to thank our panel for attending. I hope it was a useful session. And I'd like to bid all of you good night. Thank you very much.